Hi, my name is Dr. John Heary, and today we're going to be talking about carpal tunnel syndrome. So, carpal tunnel syndrome is classically characterized by someone who may have pain at the wrist, but typically they'll have numbness and tingling in the first 3.5 fingers. So, when you look at your hand, it'll be the thumb, the first finger, third finger, and also half of the fourth finger. Okay, so the nerve that goes there is called the median nerve. It travels through the wrist, through the carpal tunnel, into those 3.5 fingers. And that nerve stems and starts up in the neck area, travels through the shoulder, travels through the forearm, okay, underneath a muscle in the forearm called the pronator teres, and then it'll travel down the wrist and through the wrist, and like I said, into those 3.5 fingers. So in order to find out specifically where the nerve is giving you a problem, you have to check that entire nerve pathway. And many people, they'll have those symptoms down in the wrist and they'll be diagnosed with carpal tunnel syndrome when in fact the main problem could be stemming from the neck, possibly up at the spinal bones where the nerves come out. But there's also two muscles called the scalenes, the anterior scalene and the middle scalene, that run through this area and attach to the first rib. So those two muscles can also, if they're tight, they can also put compression or direct pressure on the nerves that can also cause carpal tunnel type of symptoms. Same thing in the shoulder, and then also in the forearm as well too, the pronator teres muscle. That is also another common muscle that can cause direct compression to the median nerve, giving carpal tunnel type of symptoms. Main thing is, want to make sure you have the entire pathway checked to find out where the problem is. And most of the time, okay, not all the time, but most of the time, we find that someone who has carpal tunnel symptoms may in fact have a problem in more than one area, which is called double crush syndrome. So that's another commonality that does take place. If you have any questions regarding carpal tunnel, please give our office a call, 545-4090, and I'll be glad to answer any questions and help you out. Also, if you would like to schedule a consultation and have your carpal tunnel symptoms, your carpal tunnel syndrome checked out, again, please give us a call at 545-4090.